There is a dangerous moment that happens in thousands of homes, and almost nobody talks about it. It happens early in the morning, when someone gets out of bed too quickly, and the room tilts for a second. It happens in the bathroom, when a hand reaches for the sink before the mind has fully understood why. It happens in the kitchen, when swollen ankles are blamed on age, weather, salt, or simply being on my feet too long. And it happens quietly, not because people are careless, not because they are weak, but because no one ever explained in plain language what life on this medicine can actually feel like. If you take amlodipine, that missing explanation matters more than most people realize, because people are rarely harmed by the warning they clearly understood. More often, they are harmed by the change they never recognized. They keep going through dizziness because they assume it is normal aging. They ignore swelling because it does not seem dramatic. They stop the medicine because they feel fine and think the problem is gone. Then they are surprised when blood pressure rises again, or chest symptoms return, or something that seemed small becomes impossible to ignore. The problem is not always the tablet itself. Very often, the problem is silence. I am Dr. Eliana Wright, and after more than 20 years in medicine, I can tell you this honestly. I meet people every week who have been taking amlodipine for months, sometimes years, and no one has ever fully explained what it is doing inside the body, what side effects are common, what warning signs are not normal, or why suddenly stopping it on your own is not a simple decision. That is why this video matters. Because amlodipine is not just a pill that lowers a blood pressure number, it changes how your blood vessels behave throughout the day. It influences pressure, circulation, and the way your body responds when you stand up, when you get hot, when you become dehydrated, when you eat too much salt, when you miss doses, and when you combine it with other medicines without realizing the interaction may matter. I have seen a woman standing in her kitchen, buttering toast, dismissing swollen ankles as just getting older, when the answer was sitting in her pill organizer. I have seen a retired man laugh off morning dizziness because he thought that was simply what his age was supposed to feel like. But he was not feeling age, he was feeling physiology. He was feeling the effect of a medicine working inside a body that had never been taught what to watch for. So today, I want to give you the conversation you should have had from the beginning. We are going to talk about what amlodipine actually does, why it is prescribed so often, what benefits it can offer, what side effects are common, what symptoms deserve faster attention, how daily habits can make your experience better or worse, why consistency matters, why stopping suddenly can be risky, and how to tell the difference between a manageable adjustment and something you should never ignore. And by the end of this video, I do not want you to feel frightened. I want you to feel clear, because fear makes people panic. Clarity keeps people safe. Let's begin with the part most people hear and the part they usually don't. Most people are given a very simple explanation about amlodipine. Your blood pressure is high. High blood pressure is dangerous. Take this every day. That explanation is not wrong. It is just incomplete. And incomplete information is dangerous because it makes people underestimate what matters. Amlodipine belongs to a group of medicines called calcium channel blockers. In simple terms, it helps relax and widen blood vessels. When blood vessels are too tight, the heart has to push blood through a system with more resistance. Over time, that extra pressure can damage the heart, the brain, the kidneys, the eyes, and the blood vessels themselves. That is why controlling high blood pressure matters, even when you feel fine. And that is one of the hardest truths about hypertension. It often causes damage long before it causes fear. Many people feel completely normal while pressure is slowly increasing the risk of stroke, heart attack, heart failure, kidney disease, and vascular damage. That is why treatment matters, even when the person taking it does not feel sick. But this is where misunderstanding begins. People hear that high blood pressure is often silent, and then they assume the medicine for it must be simple, quiet, and almost irrelevant once they swallow it. They imagine the pill disappears into the background and does its work without affecting everyday life. That is not how the body works. Amlodipine may be effective, but it is not passive. It changes the tone of blood vessels throughout the day, and because of that, it can influence how you feel when you get up from bed, when you stand too quickly, when the day gets hotter, when you sweat more, when you drink alcohol, when you travel for hours, when you eat more sodium than usual, or when another medicine enters the picture. That means safe use is not just about remembering to take the tablet. Safe use is about understanding what the tablet is doing after you take it. That is the piece many people never receive. For example, someone starts amlodipine and within days or weeks notices that their ankles look puffier by evening than they did in the morning. Their socks leave deeper marks. Their shoes feel tighter. They are not gasping for breath. They are not having chest pain. Nothing feels dramatic. So they dismiss it. They blame age, heat, standing too long, or a salty meal. Another person starts the same medicine and begins noticing a brief wave of dizziness when getting out of bed. Not enough to faint, not enough to collapse, just enough to make the world feel unsteady for a few seconds. So they study themselves, wait it out, and say nothing. These are not unusual stories. These are everyday stories. And they matter because many of the common side effects of amlodipine are easy to ignore precisely because they feel ordinary. Mild dizziness, swollen ankles or feet, headache, flushing, fatigue, a pounding awareness of your heartbeat. These symptoms do not always mean something dangerous is happening, but they are not meaningless either. They are information. They are the body's way of saying, this is how I am responding. To understand why, it helps to understand one simple truth about circulation. Blood vessels are not rigid pipes. They are living tissue. They tighten, they relax. They respond to signals, temperature, posture, hydration, exertion, stress, and medication. Calcium is one of the signals that helps blood vessel muscles tighten. Amlodipine blocks part of that signal. As a result, blood vessels relax, resistance falls, blood pressure can come down. That is the benefit. But that same mechanism also explains many of the side effects. When vessel tone changes, fluid movement changes too. That is one reason swelling can show up in the feet and ankles. It does not automatically mean heart failure. It does not automatically mean something catastrophic. Often, it reflects pressure changes in smaller blood vessels, especially lower in the body, where gravity plays a role. That is why swelling may be more noticeable by evening. That is why long periods of standing, long car rides, flights, and hot weather can make it more obvious. Dizziness works through a similar logic. If blood vessels are more relaxed and you stand quickly, especially when dehydrated, overheated, or still adjusting to the medicine, your body may need a moment to catch up. Younger bodies may compensate faster. Older bodies often compensate more slowly. Add in a hot shower, poor fluid intake, summer heat, alcohol, or simply moving too quickly, and suddenly the effect becomes noticeable. This is why the important question is never just, did you feel dizzy? The real questions are these. When did it happen? How often? What were you doing right before it happened? Did it pass within seconds or linger? Was it mild or did it feel severe? Did you actually faint? Did it begin after starting the medicine or increasing the dose? Did it happen more in hot weather or after poor hydration? Those details matter, because patterns tell the story. A symptom without context can mislead you. A symptom with a pattern can protect you. Now let's talk about something equally important: why so many people take amlodipine in the first place. It is not prescribed to annoy you. It is not prescribed to fill up a pill box. It is prescribed because uncontrolled blood pressure can quietly damage the body over time, even when you feel perfectly normal. That quiet damage is what makes hypertension dangerous. It often does not ask for your attention until the consequences are serious. So when amlodipine is prescribed appropriately, the goal is not to make you feel medicated. The goal is to reduce strain over time, to lower pressure, to ease the workload on the heart, to protect organs before damage becomes harder to reverse. And one reason people misunderstand blood pressure medicine is because its success can feel invisible. Sometimes the best medicines do not make you feel dramatically different. They work quietly in the background. That can be a blessing, but it can also create a trap. If people do not feel a strong change, they assume the medicine is not doing much. If they feel fine for a while, they start thinking they may not need it anymore. That thinking is risky, because feeling fine is not proof the problem disappeared. Sometimes feeling fine is the result of the treatment doing exactly what it was supposed to do. That is why consistency matters so much with amlodipine. Not perfection, consistency. Take it as directed. Try to take it around the same time each day. Do not skip casually. Do not treat it like an only when needed pill if it was prescribed as part of a steady daily plan. And do not make your own changes based only on how you felt for a few days. If you miss a dose, the general rule is simple. Take it when you remember unless it is close to the time for your next dose. If it is close, skip the missed dose and go back to your regular schedule. Do not double the dose to make up for it. People often think doubling sounds responsible because it feels like correcting a mistake. But with blood pressure medicine, doubling can create a new problem instead of solving the old one. And while we are talking about that, we need to talk honestly about stopping the medicine. One of the most overlooked dangers in long-term medication use is not always the side effect a person notices. Sometimes it is what happens after they stop on their own. If amlodipine has been taken regularly, suddenly stopping it without medical guidance is not a casual decision. Blood pressure may rise again, chest symptoms may return or worsen in some people. That does not mean every single person who stops it will have an emergency. It means medication changes should be guided, not improvised. And that brings us to daily life. Because medication safety is not decided in a doctor's office alone. It is decided in kitchens, bathrooms, bedrooms, grocery stores, gardens, parking lots, and quiet mornings when no one else is watching. Picture a typical morning. You wake up, sit up, swing your legs over the side of the bed, and stand quickly because you have done that your whole life. But now, for a few seconds, the room feels off. That moment matters. It does not automatically mean the medicine is harming you. It does mean you should respect what your circulation is doing. Sit for a moment. Stand slowly. Give your body a second to adjust. Now picture a hot day. You are gardening, walking, shopping, or simply sitting outside longer than usual. Heat causes blood vessels to widen further. Sweating lowers fluid volume. If you are not replacing fluids appropriately, dizziness becomes more likely. Again, not a reason to panic, but absolutely a reason to be aware. Now picture evening. You've been on your feet more than usual. Your shoes feel tighter than they did that morning. The skin around your ankles looks fuller. This, too, may be related to the medicine. And if it is mild, it may not be dangerous. But it is still useful information. Is it new? Is it getting worse? Is it affecting both sides? Does it improve overnight? Is it paired with breathlessness or chest discomfort? Is it beginning to affect your comfort, balance, or mobility? That is medically useful detail. And that is what I mean when I say safe medication use is not just swallowing the pill. It is noticing what happens next. One of the most valuable questions you can ask yourself is this. Do you know what your normal feels like on amlodipine? Not what someone online said, not what your neighbor said, not what a leaflet said in broad terms. Your normal. Do you feel best in the morning? Do you get lightheaded only if you stand too quickly? Do your ankles stay fine on most days, but swell more after long sitting or travel? Do you feel more washed out in heat? Did headaches improve after the first few weeks, or are they growing more frequent? Does your body feel stable, or does something feel newly different? That kind of attention is not anxiety, it is safety, and it becomes even more important when other medicines enter the picture. Amlodipine rarely travels alone. Many people taking it are also taking other prescription medicines, supplements, vitamins, or over-the-counter products. Some use cold and sinus remedies without realizing they may affect blood pressure. Others start a new prescription from a different doctor and assume that because each medicine came from a professional, the combination must automatically be fine. But medicine does not work like that. Each medicine may make sense on its own, yet still need review as part of the full picture. That is why one of the safest habits you can build is simple. Keep an updated medication list. Every prescription, every supplement, every over-the-counter product. Keep it in your phone, wallet, or bag. Bring it to appointments. Do not rely on memory alone. When clinicians can see the full picture, they can make better decisions. They may spot why dizziness worsened after something new was started. They may recognize swelling as medication-related. They may decide the timing needs to change, the dose needs adjustment, or another option may fit better. And that leads to another misunderstanding people carry. Once a medicine is prescribed, they think the goal is simply to tolerate it no matter what. That is not good medicine. Good medicine is not stubbornness. Good medicine is fit. If amlodipine is lowering blood pressure well and side effects are mild or manageable, that may be an excellent result. But if someone is miserable, increasingly swollen, repeatedly dizzy, or struggling to function, the answer is not always just push through. Sometimes the right next step is a conversation about the dose, the timing, the broader medication list, or whether this medicine is the best fit for that particular person. The goal is not blind obedience to a label. The goal is protecting health without losing safety, comfort, or confidence. And that matters especially for older adults, because the emotional side of medication is often ignored. Amlodipine may be a small tablet, but for many people it does not feel small. It sits beside other medicines and quietly represents aging, responsibility, and dependence. Some people resent needing it. Some fear it. Some take it mechanically without understanding it. Some stop it quietly because they are tired of feeling like life revolves around pill bottles, refills, and appointments. I understand that resistance, but resenting a medicine does not erase the reason it was prescribed, and refusing to understand it does not make you more independent. Usually, it makes you more vulnerable. Real independence is not pretending you need nothing. Real independence is learning enough to protect yourself wisely. Now, let's be very clear about the symptoms that deserve urgent attention. Mild ankle swelling is not the same as fainting. A brief flush is not the same as chest pain. A moment of lightheadedness when standing quickly is not the same as severe dizziness that will not pass. Urgent symptoms include new or worsening chest pain, fainting, severe or persistent dizziness, trouble breathing, or a fast or irregular heartbeat that feels concerning. Signs that may suggest a more serious problem, such as yellowing of the skin or eyes, very dark urine, pale stools, upper abdominal pain, marked nausea, or major loss of appetite, should also be taken seriously. These are not wait quietly and hope symptoms. These are call your clinician or seek urgent help symptoms. Now let's come back to the common side effects, because I want to give you a calm framework instead of a frightening one. Headaches can happen, especially early on. Some improve as the body adjusts. Flushing can happen. Some people notice warmth in the face or feel more red than usual. Fatigue can happen. A stronger awareness of your heartbeat can happen. Dizziness can happen. And ankle swelling is one of the better-known effects. What matters is not panicking at every symptom. What matters is learning how to observe wisely. If you notice swelling, ask yourself, when does it appear? How much? Both sides or one? Does it fade overnight? And is it becoming more noticeable over time? If you notice dizziness, ask, was I standing fast, hot, dehydrated, or exerting myself? If you notice headaches, ask, are they improving as my body adjusts, or becoming more frequent and severe? If your heartbeat feels more noticeable, ask, was it brief and mild, or prolonged and unsettling? These details turn a vague complaint into useful information, and useful information leads to better decisions. Now let's talk about salt, because this is one of the quietest ways people work against their own treatment without realizing it. Amlodipine can help lower blood pressure, but it is not magic. If a person's lifestyle is pushing hard in the opposite direction, the medicine has more work to do. The pantry matters. Packaged soups, deli meats, frozen meals, salty snacks, restaurant food, sauces, and convenience foods can quietly push sodium intake much higher than people realize. Then they wonder why blood pressure remains stubborn, why swelling feels worse, or why the medicine does not seem to be enough. Medication and lifestyle are not competing strategies. They are partners. Lower sodium choices, steady movement, weight management where appropriate, and moderation with alcohol can support the treatment plan rather than work against it. And yes, alcohol deserves a mention here too. For some people, alcohol can make dizziness and lightheadedness more noticeable on amlodipine. That does not mean every person reacts the same way. It does mean you should stay honest about what your body is telling you. If something clearly makes symptoms worse, do not pretend it does not. The same is true for heat. The same is true for dehydration. The same is true for jumping out of bed as if your circulation no longer needs time. There are two extremes I want you to avoid. The first is panic. Feeling odd does not mean you should throw the bottle away. The second is denial. Feeling fine does not mean you should stop the medicine. Good care usually lives in the middle. That middle ground is where thoughtful medication use happens. It is where you take the medicine seriously without being ruled by fear. It is where you notice changes without dramatizing every sensation. It is where you stay consistent, observant, and communicative. And perhaps the biggest shift of all is this. Stop asking only, what is the name of my medicine? Start asking, what should I notice while I am taking it? That question changes everything, because the body often whispers before it screams. Your shoes feel tighter. You feel off balance in the morning. You notice more swelling after travel. You feel more drained in the heat. You add a new medicine and something changes. Not every whisper means danger, but ignored whispers are often the beginning of bigger problems. I also want to say a word about follow-up care. A prescription should never be the end of the conversation. If blood pressure is not controlled, the plan may need adjustment. If side effects are becoming bothersome, the plan may need adjustment. If you are unsure what your target blood pressure should be, ask. If you do not know whether what you are feeling is medication-related, ask. Good care is not one prescription in silence. Good care is prescription plus monitoring plus interpretation. And for family members watching this, let me say something directly to you. If someone you love is taking amlodipine, do not wait for them to volunteer every symptom. Many older adults minimize changes because they do not want to worry anyone, seem fragile, or create a fuss. Ask better questions. Ask whether shoes are tighter by evening. Ask whether standing up feels different lately. Ask whether heat bothers them more. Ask whether they have started anything new from the pharmacy shelf. Ask whether they are taking the medicine consistently or quietly skipping doses. Those are not intrusive questions. They are protective questions. So let's bring all of this together as clearly as possible. Amlodipine helps relax blood vessels and lower blood pressure. That can reduce strain on the heart and help protect important organs over time. It is prescribed often because it can be effective and convenient as a once-daily medicine. But it is still a real medicine with real effects that deserve plain language understanding. Swollen ankles can happen. Dizziness can happen, especially with heat, dehydration, or standing too quickly. Headaches, flushing, fatigue, and a stronger awareness of the heartbeat can happen. Other medicines matter. Hydration matters. Sodium intake still matters. Routine matters. Monitoring matters. And stopping the medicine suddenly, without guidance, can be risky. This does not mean you are fragile. It means you are informed, and informed people make better decisions. So tomorrow morning, when the light comes through the window and you reach for that tablet, I do not want that moment to feel vague anymore. I do not want it to feel automatic and empty. I want it to feel understood. I want you to know what that medicine is trying to do for you. I want you to know which changes are common, which patterns matter, and which symptoms deserve faster attention. Because good blood pressure care is not about blindly following a label. It is about understanding your body, respecting the medicine, and staying in communication with the people helping you manage your health. That changes everything, because your future is often protected in quiet moments like these, in small decisions nobody applauds, in routines that look ordinary from the outside, but preserve something enormous on the inside. Your steadiness, your independence, your confidence, your years ahead. Your body has been speaking to you all along. With amlodipine, the real question is not whether you can pronounce the name on the bottle. The real question is whether you know how to listen to what your body says after you take it. Now you do. If this video gave you clarity that nobody else gave you, do me one favor. Hit the subscribe button, because I make videos like this every week for people over 60 who deserve the truth in plain language. Drop the word clarity in the comments if this video helped you, and share this video with one person you love, a parent, a spouse, a friend, who is taking amlodipine. It may protect them in a moment they never saw coming. Stay safe, stay aware, stay informed, and I will see you in the next video.